Welcome to the Digital Dose, the podcast that will be exploring how leaders use digital transformation and technology to solve real world problems. I'm Zelcha Emanuel with Amplify, and today I'm talking with someone whose leadership journey spans 3 decades and multiple critical transitions. Charles Hall started as a Navy hospital corpsman, earned his naval officer commission as a critical care nurse, and got his MBA from Johns Hopkins. He went on to become a hospital administrator of a healthcare system CEO, leading organizations through some healthcare and most challenging moments, including COVID pandemic, where he simultaneously drove telemedicine adoption, robotics program integration, rebranding, and financial stabilization. Under his leadership, organizations achieved 5-star CMS ratings, top 100 rankings in orthopedics, and quality magnet designations, and multiple clinical designations. He led a high reliability culture and earned Mayo Clinic's Care Network affiliation and comprehensive certifications. Now, as president of H&H Leadership Solutions, a service disabled veteran owned firm, Charles helps healthcare organizations across the country with executive recruitment strategy, advisory, and leadership development. His mission is empowering healthcare excellence through people, processes, and performance. Charles, welcome to the Digital Dose. I want to go ahead and get started and have you tell us a little bit about why, your military experience and what shaped your healthcare foundation.
Thank you so much for reaching out and inviting me to the show. Impact is something that's really important to H&H leadership and our journey over the last 30 years and so forth. My father was a paramedic in rural medicine in northern New Mexico. When I was a high schooler, I got to be exposed to healthcare and to emergency medicine. And when it was time to pick a career, I chose the military, knowing that my family for generations are well rooted in it, and was trained as a hospital corpsman where I was on the ambulances. I was a surgical scrub. I was in the emergency department and earned a full ride scholarship for leadership for Nurse Corps in the United States Navy. Was exposed to further the emergency department, ICU, and inpatient nursing. Chose to get out of the military and pursue my education at Johns Hopkins with a master's in business administration and healthcare systems management, and became a director of emergency and trauma services for about 10 years. Military really built the cornerstone of who I am as a leader, and healthcare is a cornerstone to the passion I believe I can contribute back to society. And I've been truly blessed to have a good number of coaches and mentors who have brought me along this journey, who have taught me good, strong lessons through this experience. And now we're at a place after all these years where I've partnered up with another gentleman, Mr. Stephen Hartz, as we have really built a company to service healthcare for longevity and viability.
Okay. That is phenomenal. So you joined the Navy as a hospital corpsman. Most people don't know what a hospital corpsman is. Can you explain what that role is and what made you choose military medicine as your starting point?
Yeah, absolutely. A good way to understand what a hospital corpsman is, most people would understand the word medic. We see that in many movies. And that's not much different when it comes to the Navy. A hospital corpsman serves not only in hospitals, but it also out with the Marines. So the Marines do not have medicine or healthcare on their own. They are supported by the Navy, and the Navy provides hospital corpsmen when they go into the field in combat and in field and in their level of support nature and so forth. And so, in that aspect, I have been out with the Marines. I have been in the hospital in both sides. My whole family has been in the military for generations. Grandfather was a Marine in Iwo Jima, grandparents that were in the Navy and the Army and the Marines. And it was a natural course when I was looking at the future to serve the country and give back. And in this case, I've chosen to go into the healthcare side to support those who really are forward leaning in their mission.
Phenomenal. So that definitely sounds like that's what drove the evolution. You became a naval officer as a critical care nurse. That's a significant transition from an enlisted officer and from a corpsman right? So with that being said, you go from Navy critical care nurse to John Hopkins to get your MBA in healthcare system management degree. That's, very intentional. So you're not just, staying clinical, you're moving into leadership. That's a big deal and definitely a business strategy. What was the vision and what were you building towards?
For those who have been in healthcare, especially at an early age, when you do the entry level areas where you're at the front lines, whether you're a tech, a nurse, something of that nature. Way back when I struggled to understand what healthcare was all about. I understood patient care, but I didn't understand how it all worked. And so I began pursuing a level of understanding on what is healthcare delivery, how is it put together, what is specialty and primary and chronic care management, what is Medicare, government payer mix? How does it support care itself? That's been my pursuit to help me understand. And as I've done that, I was able to bring that understanding to healthcare systems regions to stabilize healthcare and to be able to help continue providing great patient care to those in need.
Amazing. And then you move into hospital administration and eventually healthcare system CEO roles. What's the biggest difference between leading in the military healthcare environment versus civilian healthcare? What translate and what doesn't?
I think the mission is still the same, no matter what level of healthcare you have in the military versus civilian world. Military leadership is very different than civilian leadership. There's clear lines of delineation on authority. It's very hierarchy in nature. And so there's a culture surrounding those types of dynamics. When we go into the civilian, yes, there is authority and there is oversight, but more so it's buy-in, it's educating, it's teaching, it's what we like to call shepherding, helping people understand together, shoulder to shoulder. So the dynamics are very different. Military, it's easy to say, head that direction and everybody goes. In the civilian world, it's let's put a lot more depth in education, let's gain some buy in, let's give them the knowledge and the skill set and empowerment for them to move forward and to assure that whatever that mission or whatever that focus is, they're supported with leadership support in a nature that is successful for both the organization and that individual.
Phenomenal. Were, you were a healthcare system CEO during COVID, that leadership through the crisis generation. But you didn't just survive. You led your organization through rebranding, service expansion, telemedicine rollout, robotic program integration, and into financial stability. Walk me through that. How do you drive transformation in the middle of a pandemic?
Um, Moved from the Midwest, a little bit of the South, was leading some organizations out there and took on a role here in Washington State and a hospital CEO right 2019, right before the pandemic. And this was a organization that required before the pandemic stabilization, lots of different types of stabilization, fiscal stabilization, staffing stabilization. And so there was a vision on my purpose of going into that organization to serve that community. Of course, 3, 4 months in, when the pandemic came in, everything changed. We were caring not only for our community and the patients and their family members, but we're also caring for our staff. And so we wanted to make sure that they felt cared for. They were equipped with the knowledge and skill set in order to care not only for themselves, to keep them and their families safe, but also the community and patients. And so that, for all means, was a difficult time for our industry. And as we slowed down and reduced our services, much like America did, we were able to begin to provide a better understanding on what it needed to occur to leave the pandemic and look beyond that. And so we understood that we had some trust challenges in the community at the time. And so we worked to rebrand the organization, also rename it. We worked to expand primary and specialty care by hiring more providers. So it's instilling confidence within the system, but also within the community itself. And we were always looking at benchmarking and the bottom line when it comes to fiscal stability and in the long range. And so we found services that we ended up implementing as we were leaving the pandemic to really support the needs of the community to keep the care low.
Wow. That is significant and definitely powerful. Telemedicine specifically, most hospitals dragged their feet on telehealth for years. Then COVID forced everyone to implement it in weeks. What was your approach and how did you get staff, providers, and patients to adopt it so quickly?
Well, I think communication is key. The pandemic is COVID at the time was scary for everybody and their family members, staff and community alike. Communication was a cornerstone to it. So huddles on a daily basis, leadership huddles as well as department level huddles was essential. I attended as many as I could from a department level. So I'm the leader of the organization. They saw my words, heard my words, saw me role modeling it from a community, though our community was a bit on lockdown during that procedure, that period of time, we were able to do a weekly newspaper. Telemedicine came into play a lot stronger because people still needed their care, especially those with chronic conditions. We saw that within the region itself, transferring higher acuity patients to larger healthcare systems were becoming more and more difficult. We reached out to our community and found an amazing donor who contributed the seed money for a tele ICU to keep our most critical patients local. I think during that period of time, estimated 70, 80 lives were saved because we weren't able to transfer out, nor did we have the capability of the highest level of ICU care. And so, together as a team, we really focused on the needs of our patients, the needs of our community, and being really keen on assuring that we can meet their needs.
Wow, impressive. Your organization achieved some impressive results. So, 5-star CMS rating, top 100 ranking, magnet designation, Mayo Clinic Care Network affiliations. These aren't participation trophies, these are earned through sustained excellence. What's your leadership philosophy? And how do you build a culture that consistently performs at that level?
I I have a fundamental belief that there's no need to reinvent the wheel. Healthcare is smart. We know what good looks like. Many times in healthcare, we do reinvent that wheel. We say, I have a good idea. And no doubt, good ideas are important to innovation, but we do need to do evidence based practice, whether it's on the clinical side or on the business of medicine side. And so we want to be able to train our team to get on the same page, to have good thought partnership, whether it's the senior leadership team or the management team as a whole, providers in its core partnership, to be able to develop the vision together against benchmark standards, train to those standards, and hardwire them to assure that all of our monitoring is solid and clear, that we can make incremental changes as we improve day after day.
You emphasize patient engagement, team empowerment, and performance improvement through transparency. The word transparency is interesting. A lot of leaders say they value it, but operationally it's scary. How do you actually lead with transparency when performance data might not always look good?
I love that word transparent. You're right. Transparency is scary. It's scary to the staff and to the leaders. It shows flaws. It also shows excellence. It shows where to go. To our patients in our community, transparency gives trust. A lack of transparency gives doubt. And so our goal is to create a transparent in performance standards to not only our team, our healthcare team, on the areas where we need to improve, but to our community, our outcomes. If done well, our goal is to be the best in the region to receive care. Transparency is really important in my book because it gives confidence when done right in the direction you're heading and the work that has and will be done.
I would agree. I definitely would. You're a successful health system CEO with proven results. Most people in that position ride out to retirement. You chose to leave and start H&H Leadership Solutions. Why was that missing? And what made you say I need to build something different? Well, what was missing?
I think in my journey, circle of life journey that we talked a little earlier about a larger understanding of what healthcare is and how it works. Probably early on, I understood that eventually I would be doing what I'm doing with a company or building a company that helps multiple health systems have viability, strengthen either its fiscal performance or its patient outcomes. And so that's always somewhat in the back of my mind been what the vision of my journey was going to be. We come across really awesome, great people in our careers that have impact on our lives. And one gentleman that I came across, Mr. Stephen Hartz, was one of those individuals. He assisted me in my last organization with leadership development as well as recruitment of good talent. And the more that we spoke, the more the vision came to light on how we can have impact across the nation. And so when we had more serious conversations, it became clear there was an opportunity to build something together where we both focus on leadership, my side more on the technical, him on more of the leadership equipment. He would do recruitment. I would do advisory. We'd get out there and really stabilize organizations. And we're about 4 years together working, about 2 years into this company here. This company is a parent company that has subsidiaries attached to it with multiple companies underneath, where we're touching EMS and hospitals and clinics. We're coast to coast and really shoulder to shoulder with board members, with CEOs and their vice presidents and their directors. We're on site monthly in all of our accounts and really teaching them, partnering with them to get them to the next level of healthcare. Whether our focus is operational excellence or fiscal stabilization, year after year, we've been with our clients, really being a member of their team, shoulder to shoulder with.
Commendable. That is absolutely commendable. H&H Leadership Solutions is a service, disabled veteran-owned firm doing executive search, healthcare advisory, board development, and more. Walk me through the model when the healthcare organization engages with you, and what are you typically trying to solve? What's broken that they need help fixing?
That's a great question. As I was a hospital administrator over multiple systems, I I didn't understand at the time the power of an advisor or a coach or a thought partner. And as I came into more of consulting or advisory work, I realized that I wasn't alone when I was a hospital CEO. I didn't use consultants all that much, and that maybe there was a trust issue or definitely an expense issue. And when Stephen and I came into thinking about this, what we wanted to do is solve a lot of things. One, develop trust through performance, and then also pay for ourselves. So knowing the consultants costs a cost a little money for a healthcare system, we wanted to have a return on investment to show not only through our collaboration and our partnership with their team outcomes, but we also wanted to pay through us through revenue. And so we partnered up with every one of our organizations' finance team, teaching them operational efficiencies. And each time that we've engaged in one of our clients, we've been able to cover our costs at a 4 to 7 to 8% ratio in the first year. And so that's really important to us because we never as a company want to have the give a burden to a healthcare system of consultants coming on. So that was our first step. Our first step is how do we assure that we're not a burden, fiscal burden to them, and then two, how do we connect with them? And so you're right. We have five, actually five services we provide. One is there's always a need for great talent. My partner Stephen Hartz is an expert in that. He finds unique talent for rural, urban, academic institutions, clinics, physicians, leaders alike, and is a really great partner for boards and CEOs to really find that talent that they need to advance their healthcare. Leadership is another cornerstone that we do, and so leadership investment in the individual and developing a leadership team is really important to us. Not everyone knows how to invest in their people, let alone build a high functioning team. And so with Steve and myself and our team, we spend quite a bit of time shoulder to shoulder teaching people what leadership is and what needs to have by doing significant investment personally into them, but also in team and team building. Advisory, you can think of advisory as hospital operations and regulatory. And so not everybody has a firm understanding on every part of a healthcare system and the knowledge and the skill set. So we partner with them to fill the gaps and teach their team how to aim in the right direction to produce awesome results. Marketing is another one. Healthcare marketing is a specialty, both internally and externally, helping a community gain confidence that we can deliver great care, whatever system that it is. And then we also have management as our final, where we do manage many organizations from the top down, really working with them for viability and sustainability.
Great to know. Feel like I've gotten to know you better as an organization. You have offices in Seattle, Arlington, Williamton, Syracuse, and a nationwide footprint. Are you building a team or is it more of a network model with the strategic advisors?
We have a little bit of both. We're coast to coast and have offices on the coast as well, and then we hub out of. Um, we directly employ as a team a number of successful individuals with great experience. We are a veterans company, so we really find those veterans out there that's had success in healthcare and bring them in at all levels of military and veteranship into our company. But we also have some expertise that are strategic partners for us. So the specialty niche things that are in healthcare, we find those individuals, they are also a strategic partner for us, whether we're talking about IT or regulatory compliance, all those specialties are on our team as we approach an organization to help them be successful.
Okay. Well, speaking of specialties, you've lived through multiple waves of healthcare technology, EMRs, telemedicine, robotics. Now we're in the AI era. From your perspective, working with healthcare organizations across the country, where are the strugglings most with digital transformation? What gaps between having the technology and actually using it is effective?
That's a great question. I think much like many industries, we have early adopters, and on the other end of the spectrum, we have no-nos and naysayers. I would say the majority of healthcare are a bit laggers. Yes, we have academic institutions and large major health national systems that have embraced AI. And AI can be embraced in so many different ways. It can be embraced on the clinical front, helping with diagnostics, whether it's in radiology, MRI, CT, laboratory or in cancer studies as well in detecting cancer cells and tumors. It all can be happen. It also can be embraced on the administrative or the leadership side with analytics and managing or assessing organizational performance. We see AI being used quite a bit in the rev cycle of organizations, that it helps code the charts efficiently and effectively, helps bill those charts to the patients and to the billers at a definitely higher rate than, say, what human can do. And human has a higher level of inefficiencies and error rates associated with it. AI is more so kind of used as a cautious instrument as new tools are coming out. Of course, one of the first AI tools was ChatGPT, and so people are using the fundamentals of ChatGPT. But as we search across the industry, we find so many different types of AI that can be beneficial. What I would end up saying is AI is something that we can and should move cautiously on, but with anything with AI, it's validation. You have to validate its sources, and you have to better understand it and vet it before you automatically implement it.
I would agree. H&H is a service disabled veteran owned, and you're passionate about military to healthcare pipeline. You also volunteer with Vets for Afghan. What do you think veterans bring to healthcare leadership that's unique? And controversially, what do veterans transition into healthcare need to be successful?
Great question. When our profession, Steve is a 21-year helicopter pilot, search and rescue. He's been around the world a dozen times. When we sit down and look at, what kind of culture that we want, we're obviously attracted to our roots and that military camaraderie. That camaraderie has a unspoken nature within its communication of team and mission. And so when we look at what we know and what works well, naturally the veteran philosophy and mentality and the culture is something that we want to embrace. Not all of our team are veterans, but I think that for those who are not in veterans, they definitely enjoy the mission of what we do and what we bring and the culture of camaraderie to the team. You use the word pipeline. Yes, you're right. We're always looking for great talent, whether it is with or without military service. What we have found is the military service has a can do attitude, mission first mentality, do what it takes to get it done, partner and communicate and lead with a value system that I've seen like no other, consistency across any form of industry. And so, by nature, both Steve and I are really excited to just embrace a culture that we know, but also we were built by.
Phenomenal. Looking ahead, Charles, 3 to 5 years, what does H&H Leadership Solutions look like? And bigger picture, what's your vision for healthcare? If you get this right, what changes?
Yeah, that's a great question. Those are things in the back of our minds on it. We are blessed to be have been as successful as we have been. We are on our second company managing two national and international nonprofits in healthcare. We've recently kicked off H&H EMS Solutions, a similar model that we use across the industry with H&H Leadership Solutions. So we specialize and focus on the EMS industry. We also manage and partner up with two national international nonprofits. One is the National EMS Management Association, NIMSMA, which is a cornerstone in developing EMS leaders. And so we have international experts that partner up with us to help run that nonprofit, as well as National EMS Quality Association. That's part of our team as well. And quality is at the cornerstone in all that we do in patient care delivery. And so we have recently been in partnership with them as well and excited about the journey that we have. In 3 to 5 years, impact is our word. We want to have impact on the industry for stabilization. And in about 5, 6, 7 years, the next phase of all this is really about policy, is how we organize society ourselves on payer models, healthcare deliveries, the right experienced talent. Yes, you're right, with technology and AI to stabilize this very complex industry so tomorrow's generation can have great healthcare.
Phenomenal. Sounds great. So this has been an incredible value. Your journey from the naval corpsman to CEO and now empowering healthcare organizations nationwide is exactly the kind of leaderships that art shows digital transformation really happens, through crisis, commitment, and excellence. Thank you so much for sharing your story, and I am absolutely grateful that you were able to share it here on the Digital Dose. Okay.
Thank you. Absolutely.